A very warm welcome to this 7-day series, of which today is the first day, on behalf of SLAB, the Sri Lohana Association, Birmingham. They have kindly requested for a series of 7 days where I can share with the viewers the medical benefits from a chiropractor's viewpoint for several different conditions. Today, we start with lower back pain and sciatica. 4 out of 5 people, research states, almost 90% of the population will suffer back pain at any one time in their life. I would say, as a chiropractor, anybody who has a spine will suffer some kind of back pain at any given time in their life. So just for you to know, it is a very common presentation and very effectively treated if treated properly. Lower back pain is the second most common condition today that is documented as taking time off work after the common cold or flu. So you can imagine it's a very prevalent condition and we need to know how to look after it as best as we can. So today we're going to share some aspects of how, from a chiropractor's viewpoint, we can help you solve your back pain. My introduction is, my name is Lalit Sodha. I'm a doctor of chiropractic practicing in London, England, and of the Lohana community also. Very proud to be one. So here we're going to share, first of all, what are the causes of back pain. Now, we could spend a whole day and write a long list, but I'm going to go through some of the more common ones, starting from poor posture, altered biomechanics in your spine, from bending, twisting, lifting, all the physical activities that we do, from over-exercises or lack of exercises, from obesity to pregnancy, to wear and tear changes in your back, through vitamin D, calcium deficiency, through osteoporosis, osteoarthritis. So the list goes on. Where we are coming from is looking after the main causes of the most common back pain that one gets, often called lumbago. Now, this kind of back pain generally occurs as a result of altered biomechanics. Now, what do I mean by altered biomechanics? So, if you look at the spine here, this is your lumbar spine, which is your lower back. That's your middle back, which is your thoracic spine. And right on top is your cervical spine. Today, we are focusing on this area, particularly on this area of your spine, which is considered to be the lower back. Now, biomechanical alteration actually means if I were to take 2 vertebrae from the spine, just like so, and see how they're moving, well, altered biomechanics means that they're not moving the way they should be. So they're out of alignment, whether it's through injury, through trauma, through accident, through bending, twisting, lifting. Any one of those could cause an out of alignment, or even poor posture, as we said earlier. Now, the most common type of condition will be backache, where vertebrae goes out of alignment, gets fixed, the muscle spasms, and you start getting back pain. The other one that leads to pain down your leg is called sciatica. Now, how does sciatica occur? Sciatica occurs where the nerves that come out from your spine, and as you can see in this model, these are your little nerves, but they span all the way down your leg. If you're going to pull out 2 vertebrae from your lower back, that's how it looks like. And these nerves actually go all the way from your spine, from your back, down to your legs, to your toes. Now, often what happens is this nerve that comes out gets irritated, either through altered movement you can see, or where a disc would aggravate the nerve from here. So I'm going to press this and you can see what I mean. This is what is a slipped disc or a prolapsed disc, yeah, or a disc bulge. you can see how the bulge is coming out of the disc. Now, depending on the amount of injury, trauma, or what caused the disc to go out, will determine the length of symptoms or the amount of symptoms and the length of time it would take for you to recover. So that is called lower back pain, where the disc gets pressing onto the nerve and you get pain down the leg. That's called sciatica. Now, so lower back pain and sciatica are very, very common these days. Some of the symptoms are pain, generalized ache in your lower back, a sharp shooting pain, a dull ache, a sharp shooting pain down your leg. Now the full-blown sciatica will be pins and needles, numbness and tingling, and pain shooting down like electrical pain. It's unbearable pain. Now, it's vital to not ignore this kind of pain. The 5 most dangerous words are: do not ignore the pain. Because once you do, it starts getting from bad to worse. So, there are many options available when you first recognize the backache that you have. So attend to it then. See your general practitioner. Go see a chiropractor. They'll give you a full analysis of your back. They will go through, if you come to our clinic, which is what I'm going to discuss about what we do as chiropractors, we would go through a patient's full consultation, a very thorough orthopedic neurological examination for your spine. We would go through chiropractic tests. We would take an X-ray if it was necessary, or refer for an MRI scan if it's necessary. We have a thermal scan which measures muscle and nerve activity that we would take. After all the test procedures are done, we would actually go and get a diagnosis by looking at the case, the physical exam, and all the tests we've done. We would then sit down, go through the diagnosis with the patient, explain to them what the cause of the problem is, how long it will take to fix it, what the diagnosis is, etc. Now, that's obviously something that we as chiropractors would do. But what are the treatments that we would do? Look, at home, there are several treatments that are available. Yeah? So the basic one to start off with, whenever that pain starts, do not ignore it, attend to it. Ice pack it for 10 to 15 minutes, alternate hot and cold. Ice will help inflammation settle down. Use it for 10-15 minutes. Half an hour later, use heat for about 10 to 15 minutes. Heat will help the blood circulation go through. Now, if you repeat the hot and cold cycle through the day, about 3 or 4 times, that will at least help your pain. The second thing that's readily available is using some gels, some anti-inflammatory gels that you can use. I firmly recommend a cooling gel rather than a heating gel, so deep freeze or cooling gels are what we would recommend. The third thing that's available at home is actually resting it out. So rest it out, but do not do total bed rest unless absolutely indicated. So a bit of mobility will help retain the mobility in your spine. After that, you can use, as I said, the anti-inflammatory gels. Now, if available, immediately see a chiropractor. They will absolutely guide you through what needs to be done. As a chiropractor, we would come to a diagnosis, and then our method of treatment is physically realigning the spine through physical manipulation done to the spine. Now, there are various methods. There are gentler options, there are firmer options, and it very much depends on the kind of patients that are coming. So, these are the brief opening pointers on what we can do for lower back pain and sciatica at home. I will demonstrate some exercises in just a few minutes, but I would like you to understand and take a few points from here. Number one, lower back pain is one of the most common conditions that all of us will suffer at any one given point in time in life. And the second message is, do not ignore it, attend to it. Get it checked so that you can save a stitch. Well, a stitch in time will save 9. So look after it initially before it gets worse. Now, some of the stretches which you can do while you're sitting is a very simple one. You can actually, while you sit, bring your knee to your chest and stretch your back. Hold that for about 10 seconds. Okay, now bring your knee to the opposite shoulder and you can stretch that for about 10 seconds. So this is one of the sitting exercise, knee to chest. You do it one leg, you do it the other leg also, and alternate and repeat 10 times. The other one that will also help while you're sitting is just bringing your foot onto one leg, sitting with a very straight spine, and try to, if you can, push your knee down and get the leg moving, so we're getting some lower back and hip movement with it. Hold this down for a good 10 seconds, relax, and then repeat that on the other side. Hold it down for 10 seconds and relax. You can do that 10 times each side. Last exercise while you're sitting you can do here is actually grab the back of your seat, get this arm out and go behind, and you will actually try to stretch as best as you can while you're sitting. When you turn to one side, hold it for 10 seconds, and then you come up onto the other side and hold it for 10 seconds. There is a very good twist to your spine, as you can see happening. So you actually don't have to go anywhere to get the exercises done. You can do them while you're sitting. Now we're going to demonstrate some exercises while you're lying down.